A heart attack, medically known as a myocardial infarction, heart attack is one of the most life-threatening medical emergencies in modern medicine, but it rarely begins in a single moment. Instead, it is often the final stage of a silent, progressive process that can develop in the body for many years. Every year, millions of people worldwide are affected by this condition, and many are unaware that a dangerous change has already occurred in the arteries supplying blood to their heart. The human heart is a remarkable muscle. It beats approximately 100,000 times per day, pumping thousands of liters of blood to deliver oxygen and nutrients to every organ and cell. But like every other organ, the heart itself depends on a constant supply of oxygen. And this is provided by the coronary arteries. When these arteries are healthy, blood flows without obstruction. However, over time, factors such as high cholesterol, uncontrolled high blood pressure, diabetes, smoking, physical inactivity, a diet high in saturated fat and processed foods, and genetic predisposition can cause a buildup of cholesterol, fat, calcium, and inflammatory cells along the inner walls of the arteries. This process is called atherosclerosis, and it is the most common underlying cause of heart attacks worldwide. In the early stages, this buildup only slightly narrows the artery, which is why most people have no obvious symptoms. This is why atherosclerosis is often called a silent killer, as the plaque continues to grow. The space for blood to flow becomes smaller. At some point, the atherosclerotic plaque may rupture. When a plaque ruptures, the body treats it like an injury and immediately forms a blood clot. Within minutes, this clot can partially or completely block the coronary artery. As blood flow stops, the section of heart muscle supplied by that artery is deprived of oxygen within just a few minutes. Heart cells begin to suffer irreversible damage, and if blood flow is not restored quickly, those cells can die permanently. This is called a myocardial infarction or heart attack. This is why cardiologists emphasize a critical principle: time is muscle, because every minute of delay results in more heart muscle loss. And the more muscle that is lost, the weaker the heart's function can become in the future. Although a heart attack is often perceived as sudden, the body frequently sends warning signs hours, days, or even a week beforehand. These warning signs can be categorized into 7 key symptoms. Number 1, unusual fatigue. A sudden, severe exhaustion that does not improve with rest and may interfere with routine daily activities. Number 2, shortness of breath. Difficulty breathing that can occur during minimal activity or even at rest. Number 3, chest discomfort, pressure, squeezing, fullness, or heaviness in the center or left side of the chest. Number 4, cold sweats. A sudden onset of cold, clammy sweating without physical exertion or fever. Number 5, lightheadedness or dizziness. A feeling of being unsteady or as if one might faint. Number 6, radiating pain, discomfort that spreads from the chest to one or both arms, the neck, jaw, back, or shoulders. And number 7, nausea or stomach discomfort. A feeling of indigestion or nausea without a clear gastrointestinal cause. It is important to note that symptoms can vary between individuals and may be less obvious in women. Older adults and people with diabetes, if any of these symptoms occur, especially chest discomfort combined with other signs, emergency medical services should be contacted immediately. In the hospital, physicians confirm the diagnosis using an electrocardiogram or ECG and blood tests for cardiac markers such as troponin. Treatment often involves a primary percutaneous coronary intervention. or angioplasty to restore blood flow, the most effective treatment is always the one started earliest. Because heart muscle that is lost cannot be restored, the positive news is that most risk factors for heart attack are modifiable: quitting smoking, eating a balanced diet, regular physical activity, maintaining a healthy weight, controlling blood pressure, blood sugar, and cholesterol. Getting adequate sleep, reducing stress, and following medical screening recommendations can significantly lower risk. Heart attacks are not limited to older adults. Today, younger people are also at risk due to unhealthy lifestyles, smoking, diabetes, obesity, and chronic stress. Prevention begins with awareness, and awareness begins with understanding the signs.